Our final session, isn't it? Final session today. And who better than Professor Sarica to start off this final session for us, who will tell us about pros and cons of single-use flexible ureteroscopes. Thank you, Professor Sarica.
Thank you, Simon. Thank you so much. Dear friends, dear colleagues, again, brothers and sisters in stone. We are all stone men. You don't understand from pediatric urology, oncology. I know there are something over there, but at least in my life, over in the last 15 years, always stones and stone men. You will be also good stone men and women, I know very well. And I wish you luck in your career from now on. So, last session, and let's talk something about flexible ureteroscopes, single-use scopes. We've been using them for a long period of time, I can say, and at what point we are. Do they have any advantages? Do they prove their efficacy in terms of success rates, stone-free rates, practical usage, something like that? And I will touch on them over the, let's say, 20 minutes. It will be enough, I think so. So, as we all know, flexible ureteroscopy is a well-established and commonly applied modality, at least in all parts of the world now. However, flexible scopes are expensive and fragile. We know very well. And I remember one reusable flexible scope and get damaged after first use. I know, and we had this scenery, and we were upset, we were very sad, but it was the case, and we waited another month or 2 months for the other one because hospital administration tells that money, where is the money? High cost was the real problem. I will touch on that. Since 2006, with the advent of digital flexible ureteroscope, a great evolution has occurred, and we know, and you know, the first single-use flexible ureteroscope has been introduced for clinical use in 2011. And one after the other, new models are coming with new, let's say, characteristics and advantages, let's say, we discussed. One of them is will be coming with now pressure, let's say, transducer. The other one for heat changes in the, one after the other. These improvements will follow each other. The significant improvements in flexible have made flexible ureteroscopy the main treatment modality to target upper urinary tract pathologies, especially stone disease, in a really minimally invasive manner. Low invasive nature of the procedure has made it a worldwide popular. However, as I told, expensive instruments, and they have limited longevity. Hence, there is a great concern globally, everywhere, regarding their high costs at the moment. What do we expect from a flexible scope? There are some expectations if we use them with this aim. A flexible scope should provide first a good image to see the collecting system, stone, and other details. It may allow us to access to entire collecting system, lower pole, upper pole, everywhere, because stone can be everywhere, in every part of the collecting system. A good irrigation flow, despite having a device in the working channel. This is important. And during the live surgery demonstration, Dr. Benzon, he changed the laser fiber from 500 to 200. This was SMP, but this is also valid for flexible scopes. Thinner the accessory instrument is, then you will have more, let's say, adequate fluid flow inside. And durability at a reasonable cost scope. Marked advances have been witnessed in flexible ureteroscope technology in recent years, but problems regarding its durability and cost issue still persist. Considering these facts, manufacturers have launched single-use ureteroscopes. Currently, there are several single-use models with some certain advantages and disadvantages when compared with the reusable ones. So, flexible ureteroscopes, they may be reusable, and these reusable ones, first we used a lot the fiber optic ones. Today still in many centers it's being used, but the image quality is somehow lower than when compared with the digital and also digital disposable ones. This is the issue. And this is a reusable flexible ureteroscope. And when we compare the reusable scopes, you see the technical details regarding the outer diameter. It changed from 9.9 millimeter till 7.5 for the adult population, I mean. And deflections are more or less the same, as you see. These are the reusable scopes. Then, as you see, beginning with little view, some different flexible scopes, single-use scopes have been introduced. And when we evaluate their characteristics, again, in the beginning, we had outer diameter somehow larger, but we used them with larger access sheets, 12-14, 11-13 to some extent. But today, we have thinner, 7.5, even 7.2 sized single-use scopes. Deflection rates and working channels are similar to reusable ones. Image quality coming from fiber optic to digital, you see the difference you saw in many cases, and it's a great advantage. Sorry, can we go further? The other slide. Okay. But consisting problem is the high costs. For the reusable ones, what constitutes the cost? Initial, we pay a lot, high cost. Cost of repair when needed, we need at occasions and it hurts. Personnel to take care of cleaning, sterilization, keeping in proper place, box. Lady, man, who is responsible? You should keep an eye on. You tell several times, please, please take care. Very important. And disposable instruments used with flexible scope, you need them. And finally, when a reusable scope breaks, some institutions may experience a significant delay for its replacement or repair, and you have patients in your waiting list to be operated. Residents you can't tell that it's over 6 months, 1 year, no more, and they are obliged to have a backup position to go further with these procedures. Reusable scopes are expensive device. A high initial investment. It includes purchase of light source, camera, image processor, monitors, cables, all others. This is a system. You can't buy a reusable scope only, and to using it, you need the other systems also together with to institute this system. Also, processing instruments after each use. Specialized personnel, carefully, facilitates, involves cleaning, decontamination, drying, testing. These are all financially consuming. You need to pay also for the personnel. Sometimes in some institutions, maybe a little bit more paying. Please take care. Keep an eye on. Flexible scopes can be damaged or broken either during surgery, during or after, at all phases, if you don't care. It's well known that instruments manipulated by many surgeons and by inexperienced urologists, residents, higher chance of damage is highly likely. Mishandling during reprocessing and out of the operating room can be responsible. Here you see between 8 to 22% of the damage to the flexible scopes. Repairing, difficult, almost impossible, sometimes in developing countries. It's finished, they say. Wait for a long period of time. The cost of single-use flexible scopes, however, comprise only the cost of scope. Once processor image unit is provided by the manufacturer or the representative. That's all they bring you. That means you may pay less in the beginning. initially. A study showed that processing of the ureteroscopy after surgery takes an average of 230 minutes, while the mean case duration of flexible ureteroscopy for treating a renal stone is around 64 minutes. At the same hospital, processing a single flexible ureteroscope costs around $100, with the cost of single sterilization cases by responsible for the 25% of all costs. These are all costs: repair, cleaning. In another study from USA, the authors evaluate the cost of 160 procedures performed with Storz Flex Reusable and compared it potential cost with a single-use litho. The cost of each procedure with flexible reusable one is around $850, and the authors concluded that in their center, single-use scopes were cost-effectively if less than 99 procedures were performed each year, and recommended single-use devices with this volume of cases in their department. According to the reported literature data, a fiber optic scope needed repair after a mean of 21 cases, and the digital scope after 10 to 21 cases, and you see again the cost of repair. The durability of a repaired flexible scope is inferior. We know it's repaired and it will not be as the one original when compared to a new device on a 7 procedure maybe. None of these concerns are valid for single-use ones, and surgeons have the additional advantage of using a brand new one each time. This is another advantage. Then in a study, the authors did evaluate this issue, and they concluded that there may be 3 models of cost analysis with single-use scopes. The first is in high volume centers. We have a lot of cases. 32 cases maybe every day operating, where the high number of scopes used leads a reduction in the scope's processing time, resulting in a final gain to the institution. The second model is for hospitals with a very low volume of surgeries, where the initial investment and maintenance cost of the facilities where a flexible ureteroscope could be performed is not cost effective. The third model is the adoption of a hybrid system, they quoted, where single-use scopes are used in those cases where the chance of breakage or of a reusable scope is higher, SIP angle, anatomy, patient-related factors, large stones, complex stones, anomalous kidneys, or blood. In these cases, it could be wise to use single-use scopes. Recent studies also reflect the economic implications based on the case volume per center, and studies show that disposable ureteroscopy may be suitable for low volume stone centers when compared with high volume ones. Here you see reusable scopes will require pre-cleansing, leak testing, manual cleaning, rinsing, drying, sterilization, storage. All are demanding procedures requiring care, money, and personnel. On the other hand, disposable single-use scopes will not. How about the mechanical advantages? Single-use scopes may show more bending flexibility and improved deflection is up to 75% degree at the distal end, and additional and increased irrigation flow rate by 30 to 70%, both depending on the device in the working channel. Another potential advantage of single-use flexible ureteroscope is every time a new and sterile product, having highly reproducible and guaranteed quality in terms of image resolution, distortion. You will have no concern with the, let's say, practical and effective use of the scope at every case. New scopes usually last 4 times more than refurbished ones. That's a reality, and single-use scopes have good resilience throughout long cases. Longer scope longevity is achieved with Sidex, and if a dedicated nurse takes care of this process. The main surgical factors that negatively impact device longevity is lower pole stones, large stone burden, demanding longer operation time and non-use of a ureteral access sheath if unsuccessful. In principle, the disposable ureteroscope eliminates the high cost of reusable scopes purchase and repair. It also abolishes the theoretical risk of cross-infections and the need for a true sterilization process. Additionally, the disposable scope allows more torque in the instrument during a stone treatment procedure. You are in comfort. You may force yourself. You may be, okay, let's go and treat. Bend as much as you can. It's a single use, you say. But for the reusable one, stop here. It is expensive, you say. This is also another task. How about treatment efficiency? Efficacy of single-use and reusable scopes have been found to be equivalent, similar. Due to the reduced risk of ureteroscope damage, disposable scopes are especially effective, again, for treating complex stones, lower pole, large stones. In a recent study, Margaret and his co-workers compared the use of disposable and reusable scopes and reported similar stone-free rates, operative time, fluoroscopy time, and higher rate of complications when using single-use devices. That's a nice study. 115 cases with single-use, comparing 65 cases with reusable one, and outcomes and complications were found to be comparable in the end. Mean procedural duration was in favor of single-use one. Stone management procedural stone management duration, you see, in favor of, again, single-use, and percentage of scope failure, again, it was in favor of single-use scopes in this study. A nice systematic review, 11 studies concerning these outcomes and more than 460 cases. In vitro comparative data were available on 3 single-use scopes in this study. Clinical data were available on 2 scopes. The overall stone-free rates and complication rates associated with single-use was, you see here, and with the other one. And no significant differences in procedural duration, stone size, stone clearance, and complication rates have been observed when single-use flexible ureters and reusable scopes were compared to each other. That means comparable efficacy could be mentioned for both of them, but we need further studies on clinical efficacy and costs to truly and, let's say, reliably establish and report the outcomes regarding the cost issues. Let's say study 2019, 59 papers considered the relevance of and selected and analyzed studies. Stone-free and complication rates were again similar for both scopes. Operating time was in average 20% shorter with digital scopes, whether it's single use or not. Let's pass this one. Yeah, this is in vivo comparison. Again, operative time you see here, stone removal and scope failure, as I mentioned in the study a while ago. This is a European multi-center study published, 40 procedures, 5 centers, 8 cases per department. And here you see, during the last evaluation, mean upward and downward deflection rates. The image quality was stated as very good in 65% of the cases and good in 35% of the cases. Maneuver capability was very good in 72.5% of the cases in disposable scopes. In such cases, if you have steep, let's say, angle, and if you want to are prone to force the scope in the kidney, it's clear now if you have the chance to use the disposable scope to go further. How about operative time? Evidence showed that surgery time is reduced by up to 30% when disposable devices are used. Judicious use of these devices can be advantageous for larger stones, as larger stones will require more fragmentation. Surgeries with operative time longer than maybe an hour and a half, it will significantly increase also the infection risks. In a series published by Somani and his co-workers, the cases performed with the Olympus had an operative time 9 minutes shorter than the other scope. Similar results were observed by the other group comparing the Litobu with reusable flexible scopes, and here you see operative time is really lower when you use disposable single-use scopes. Operative time should also be considered when discussing the choice for a flexible ureteroscope, since longer operative times impact directly the costs, repair of it. Both reusable and disposable digital flexible scopes present 20% shorter operative time. And as we monitor the evolution of laser usage, we believe the cost of single-use scopes will further decrease over time and allowing us and using them in a cost-effective manner. With the advent of single-use ureteroscopes, there has been a revolution in the field of endourology with more than 5 disposable scopes available in the market now. Scope parameters outcomes are comparable, and cost of disposable scopes is generally perceived higher than reusable one, but as I told you, it depends on the case load. How about complex cases? Complex cases, particularly in the lower pole, they will require greater deflection. A previous study investigated the access to the most caudal calyx of the lower calyceal group with the optical ureteroscope, and they show that depending on the anatomy of the collecting system, the access rate could be between 64 and 85%. In these cases, when there is a greater risk of damage to the device due to the forced deflection, single-use scopes will be used. How about infective complications? You see the incidence of infective complications. It is, and it's not negligible. It's possible. And a published study by Offset and his co-workers showed that presence of bacteria, hemoglobin, and protein inside the reusable scopes after manual cleansing and sterilization by hydrogen peroxide gas, but there are no clinical data. They show that, but there are no clinical data proving the influence of these findings on the appearance of or incidence of infections following ureteroscopy. However, despite these data, single-use ureteroscopes did not decrease the occurrence of infections after ureteroscopy based on the limited data published so far. That means we need really publications on this issue. Single-use scopes is an excellent option for treating stones in congenital malformed kidneys, such as ectopic pelvic kidney, horseshoe kidney, due to its high stone-free rate and low risk of complications and of course costs. So disposable scopes currently they may have a, let's say, established role in the management of lower pole stones larger than 1 centimeter or multiple stones. Renal stones larger than 2 centimeter. Cases of urinary diversion or abnormal renal anatomy. Steep infundibular pelvic angle that we may identify first and then decide what to do, how to use. Patients with previous stone-related urosepsis or multi-resistant preoperative urine culture in these cases, and also cases with a risk of scope leakage or a hazard of scope contamination with high infectious cases. These are the established indications so far for single-use disposable scopes. Newer scopes provide similar maneuverability and clinical efficacy to the reusable scopes with equal and low complication rates. Studies show that last generation digital and high performance single-use scopes may be preferred in problem case again and again. When the market price of purchasing a new scope is elevated, or if ureteroscope repair price is high, again we will turn our direction to single-use scopes. In addition, we are working in academic centers, and they may find a place for single-use devices in hands-on courses and residence training. Also, as I told you, you have a reusable one. If it is damaged, if you don't have any other, then all your activities will stop. Finally, no instrument is failure-proof, and a backup device, single-use or not, should always be available, as I told. When we evaluate the environmental impact of single-use and reusable one, of course, you know, it will be statistically meaningful between the scopes themselves. So to conclude, I may say that current established concepts reveal that single-use flexible ureteroscopes are lighter, have excellent deflection and irrigation parameters. We use them and we know now. They have superior quality of image when compared with the particular fiber optic reusable ones. Single-use scopes do not have enhancement image technologies present in reusable one, and that can make difference in the treatment of ureteral tumors. No definite data regarding a higher stone-free rate or less complications with the use of single-use flexible scopes has been reported, but the operative times are shorter when compared with the reusable ones. Furthermore, they can be of great value in difficult cases where the chance of instrument damage is highly, particularly for lower pole stones, larger stones, complex stones. Regarding cost, each institution must perform a cost-benefit analysis before making the decision of adopting or not such devices, depending on local circumstances, also state rules and approach of Ministry of Health to your. In conclusion, here you see again potential indication for disposable scopes, unfavorable location of stones, procedure with expected difficulties, with surgeons with low experience and limited number of cases, backup and severely infected cases. Thank you so much for your attention, and again, waiting for you in London in October. Thanks a lot. Thanks for joining.
Okay. Professor Kemal, very nice presentation. Actually, any question from the floor, audience?
Everything's clear.
It's clear.
No question.
How many units keep a combination of disposable and reusable flexible ureteroscopes? Half? Yeah, half. Yeah. I think the cost of disposable scopes have gradually come down a lot.
Yes.
So it's now nearly 1/3 of what the initial scopes were.
Yes.
So it's becoming more affordable in centers where there's a high cost of cleaning, high cost of breakages like ours, where the cleaning center breaks our scopes a lot. Then it makes mathematical sense to use more disposable scopes, isn't it?
Exactly. I myself, in our department, we have reusable scopes, but we don't use them in all cases. It's not an effect. Now, we are using single-use scopes in the majority of the cases because, as Simon quoted, the prices are really affordable, and they are coming down and down. And we know, at least in my country, there is a great competition of at least 5 companies. Great competition. It will bring further the cost of all this one. It will further bring, and we are sure in the future, flexible scope will be the choice in the majority of cases.
Actually, so in China, more than in companies to do single-use pressing. 50. Yeah. You're supposed to use press mask and down.
Each time you, sorry,
Please,
yeah. Francisco, no, carry on.
No, just a question to you, Professor.
Please.
What do you think will be the most important innovation for this disposable scopes? The size or some additional devices like the pressure measurement or the vision, proof vision?
Yeah, it has been discussed during this workshop already. You know, size are coming to the lower edge, and we have now 7.5 per inch. It was a breakthrough, really, for tight ureters requiring no ureter accessories, and also in children. In addition, we discussed that now pressure into transducer on tip of the digital single scope on the edge. Shortly, it has been introduced, I think. And another advantage could be we will use more and more thulium fiber laser in the management of stones, and larger stones in the future. It may cause high temperatures in the renal collecting system, I'm sure. Also, heat transducer will be another, let's say, breakthrough game changer with single-use scope in the near future.
Sir, to say for those scopes, the disposable.
Very nice question. Vital question.
Insurance number. So where I come from, for example, can't afford. Would you think if we realize your idea?
If you ask me the reality, I tell you the reality. I will tell you the dream. Reality is single use, not single use. Somehow lowered multiple use.
I think the name is disposable scope, not single use.
Yes, you are right. Yes, you are right. I call it as lower rate of multiple use. This is the reality. But the dream is somehow in the future for those countries use it. Throw it. Oh my God, when? Someday maybe. This is the dream. Answer is the problem.
Throw it, someone will get it.
When you use a reusable scope like ours, each time you use it, the quality of it decreases. The deflection will get worse. You lose more visibility. Sure. Yeah. And more damage inside. And you see more proteinaceous material, bacteria inside that you don't know of. But when you use the disposable, each time you use perfect reflection, perfect vision, no bacteria inside.
Perfect comments.
Yeah.
Thank you so much.
Okay, because Dr. Chen Fan from Wuhan is not available today, so our next speech will be from the Professor Simon Chung.